A lot of them struggle. They then end up either homeless on the streets, or they end up incarcerated in prison, or they end up, institutionalized, which really harms their recovery process. I was really that perfectionist, which is a blessing but also a curse. So before I knew it, I, then collapsed. My brain collapsed, and obviously my body collapsed. I lost functionality in life. I could no longer function as a human being. Hello, hi everyone. I'm Puan Anita, the president and also founder of MIASA, the Mental Illness Awareness and Support Association. What made me begin this initiative or interest and passion in mental health was really due to my own struggles with a mental health condition. I was diagnosed 9 years ago, and I felt during the time truly helpless, alone in my struggles, because if you remember 9-10 years ago, there wasn't really much, at least in Malaysia, awareness on mental health. There wasn't necessarily a poster that said, do you have anxiety? Are you struggling with depression? This is a helpline that you could call, or these are some resources available, or these are some practical tips that you can work with, as an example. So due to that, I felt very much the need, as I went through that recovery process, to really provide a platform, I hoped, during the time where people or others wouldn't have to go through the loneliness and hopelessness. And also at times you feel trapped within your own struggles. And through this initiative, that people would find that connection and support that they need. So it's not just limited to clinical help. So that was how I got into the mental health space in the beginning. I struggled with mental health issues since I was a kid, although I only knew after I was clinically diagnosed. I was clinically diagnosed 9 years ago, and I live with a mental health condition, specifically anxiety disorder, panic disorder, and also mild depression. And it was a time in my life where, I was at the peak, peak of my career. I was doing really well. I had, 2 beautiful children already during the time. They were 3.5 and 5 years old. I was working. I come from the corporate sector, so I was an investment banker. So I was working. I was doing my master's at the same time at the International Islamic University here. And so I was juggling, multiple hats in that sense, right? Wife, mom, really an employer, and then studying. And stress was something that I really liked. That doesn't really sound right, but it really helped me to achieve what I needed to. And I really loved working. I really loved studying. I really loved being a mom at the same time. So I thought I was invincible, right? But we're only humans. There's only so much my brain can do and my body can do. So I wasn't really taking care of myself, as in I wasn't sleeping well or on time. I wasn't eating well. I wasn't resting enough. I still remember days months actually, that I would sleep, just a couple hours, really a couple of hours, maybe 2 hours a day, and that was it. I always felt that sleeping was a waste of time. And so whatever time that I had that I could, think and function, I would always work. I would read. I love reading as well. So reading helped me in my work, helped me in my, speaking engagements, etc. So, my time was really occupied very much and tremendously, and also taking care of my kids, teaching them, really wanting them to excel like how I excelled, so I was really that perfectionist, which is a blessing but also a curse. So before I knew it, I then collapsed. My brain collapsed, and obviously my body collapsed. I lost functionality in life. I could no longer function as a human being. I couldn't take care of the house, couldn't take care of the kids, couldn't work, couldn't drive. Even some days it was difficult to breathe. So I left my, because I was running my own business already during the time, and I just left it, left it to all my staff members to run. Obviously, it didn't do well after I just left it, and I could only speak to my mom and my husband. I couldn't open up to anyone. I felt very afraid constantly. I panicked a lot. I experienced a lot of panic attacks, and then all these numbness and sadness and overwhelming anxiety, and really feeling trapped and hopeless within my struggles that I didn't understand. So it's as if your brain is trying to kill you. So it becomes really catastrophic. And so I immediately fell into this deep and dark hole where I couldn't see a way out, where I didn't know how to overcome all these struggles. And I was really confused because I didn't necessarily during the time knew how to articulate, right? All these challenges and really emotions and all these difficulties that I was experiencing. I think one, I didn't know how to express myself, although I am an expressive person. Two, I was afraid that people might think I was crazy. And also because I've been normal before. So I kind of knew what people would maybe, what kind of judgments or what kind of conclusions they might come up with once they hear what I have to share. So I think there's a lot of fear and a lot of shame. I think shame was one of the biggest hindrance that I had. And then secondly was the fear. So I felt really ashamed if people knew really what I was feeling and what I was struggling with during the time. Because imagine being in that position, in that leadership position, and being a mom, and I was doing really well, etc. Everything was just working for me, and then suddenly, everything collapsed, that I couldn't function as a normal human being. So I think a month into the condition, I then, could relate as to why people ended their lives, right? And I think I was shocked at that moment when I could relate and understand this. And that was when I then connected, through a spiritual level. I went back to religion. I started learning about the reasons why we go through hardships in life. I started, reading the Quran, learning about it, going back to my prayers. Not that I didn't pray, I did, but I didn't really necessarily felt connected to God in that sense. And then I started learning about my symptoms. I started digging out, why was I afflicted with this condition, right? What's the crux of the issue? And so all of that, and then building that coping mechanisms for me, because I lost that functionality, and because I wasn't taking care of the kids, I pushed everyone away. And I think when I went through all these rock bottoms that were numerous, right? That was when anger kicked in, willpower came in. I then pulled everyone closer to me, my kids and my husband, my mom, everyone, because everyone was trying to help. But I didn't necessarily know how to receive that help. I wasn't open because I didn't know how. Asking for help wasn't something normal for me, because I would be that person that would help everyone, right? So I didn't know how to receive help. And I think that was one of the barriers to my recovery in the beginning. And so eventually, after I, brought everyone closer, learned about my condition, connecting with religion, and really from that holistic approach to my recovery process, and knowing other people that were struggling with the condition, that was when I felt less lonelier. And that was how I was able to cross over to recovery. One day I was casually talking to my husband about, several things, just chit-chatting. And this was when I was already in that recovery process. It took me, 2+ years, really. And he casually mentioned, or suggested, he said, why don't you go public with your condition? And I was truly shocked because there's a lot of stigma, a lot of shame, a lot of fear attached to a mental health condition. And really, the conversation alone is still very much not something that we discuss openly. The pandemic definitely helped to normalize this discussion. And my husband, I said, I asked my husband, I said, aren't you afraid that people are going to say, your wife's crazy? Because that's typically what people might think, at least during the time when you talk about mental health 9 years ago. And he said, no, definitely not, because I know you're not crazy. And so what happened was, through that conversation, I started creating quotes, I started creating posters, and then I shared it on social media, specifically on Instagram. And I still remember when I was about to hit that share button, I felt really nervous, but also at the same time really curious how the response was going to be. And what happened was, I received hundreds of messages, not just of support, but people opening up and saying that they too are experiencing or have experienced what I went through. And that was how the whole initiative started, really with a support group. And that was when I decided to really formalize, this whole initiative. And I really wanted to create an impact where people didn't have to feel alone or struggle alone, right? Because desperation is something I know all too well. Sometimes people just need a leg up, people need support, a place to go, especially a safe place and space. And this was what MIASA offered and how we began. And then through that support group initiatives and programs that we had, which the brainchild was actually called Journey to Recovery. So that was my brainchild when I began, that everything else just, fell into place. Our services are really numerous, and that's what we try to do. We try to vary our support services as much as we can, because we want to ensure that there is always something for everyone on the menu, right? So we're in the community. There's not a sustainable model in the community. However, at MIASA, we do have a wide range of support services, including peer support, family support. We do spiritual therapy. We provide and offer art classes, speech and drama, expressive dance. We do counseling. We have mental health assessment. We also do clinical assessments. We provide psychological services, whatever therapy it might be. We also do supported employment programs where we find jobs and place people according to what they're passionate of, and according to their strengths and also limitations. We also do a lot of our outreach programs for the homeless people, and also the marginalized and more vulnerable groups. And we also have our 24/7 crisis helpline, 24/7 crisis WhatsApp line. We also have our 24/7 chat bot, and also we're on social media and also WhatsApp channel. So there's really lots of ways to reach us, and hopefully through all these services that there's always something for everyone. There's various challenges, and the challenges differ because when we began, we had different sets of challenges versus today. So it's really different. I mean, it's been 7 years, right? I think in the beginning is more about creating that visibility, the marketing. We didn't have funds, and then there was also resistance. And I think that was really that challenge. And then capacity building then became a challenge as we kind of grew. And then also the stigma till today, right? It's so prevalent. But of course, the pandemic really helped to normalize it. So stigma has reduced quite a bit, and mental health literacy has increased, help-seeking behavior has increased. But it doesn't mean that stigma is not there. It's still there, because a lot of the awareness has, really it happens more within urban areas, right? It's really geographically more concentrated here, really in major cities, Kuala Lumpur per se, because more of the services the HQs of NGOs, social enterprises, etc. Within the impact space. Usually, it's here, right in the city center. So because of that, stigma is still very much prevalent. And then I think the other thing is not having a sustainable model in the community. And because we work so much with more marginalized, vulnerable groups and more of the bottom 40 income earners, which is about 75% of our clients, that it becomes very challenging, because sometimes we too reach a dead end. A lot of them struggle. They then end up either homeless on the streets, or they end up incarcerated in prison, or they end up institutionalized, which really harms their recovery process. You can't have an effective recovery process when you don't have effective treatments. You don't have support. There's not that holistic approach to that recovery process. So without that sustainable model in the community, not everyone's recovery journey is going to be effective and successful. Like everything else, we face a lot of peers with anxiety, specifically anxiety disorder and also depression. So that's the most. But we have people that come with various mental health challenges and clinical conditions, really. So ranging from bipolar disorder, schizophrenia disorder, adjustment disorders, personality disorders, addiction problems, various addiction problems, right? From drugs to alcohol to pornography to sex to masturbation, gaming. So there's really massive. And then we also have people that come in with mental health issues. That means it hasn't developed into a clinical condition yet. So we're very happy when people with issues come in, so that we can provide the intervention and help early, before it develops into a clinical condition. So these are really things that we've seen. And I think that via this pandemic, it has exacerbated a lot of the mental struggles of people. So today we see more people being clinically diagnosed, a lot of people going through stress and also burnout. This is also what we see, and of course fatigue, right? And I would say the majority is still, however, anxiety and depression. Got two ways. One, we do a DAS test. So we just do the normal depression, anxiety, stress skill test, which is not a clinical assessment. But then if the results come out severe, then we do refer them to our psychologists to do a clinical assessment. And that's how, we begin with a working diagnosis and then eventually a clinical diagnosis. So that's usually more of the clinical side of it, because only a clinical psychologist or a clinical psychiatrist can provide diagnosis. So that's how it works. But a lot of people, when they come in, typically they come in for a consultation. And what we do is we lay out all the support services that we provide, and it's entirely up to them, which one they pick and which step they would want to embark on first, because at MIASA we're big on supported decision making and providing full autonomy and liberty to all our peers. So we don't make decisions on behalf of anyone. We just empower them to make that decision for themselves.